Hello, and welcome to the learning series titled Learning Together Emergency Shelters and Substance Use Facilities. Please note that this session is being recorded. We are pleased to offer French simultaneous interpretation for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your Zoom screen. If you need support at any time during this webinar, you can reach out to one of our producers using the chat feature. My name is Jessica Hodge, and as program lead on this program, I am so excited to be joining you as the host for today's huddle. I would like to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, I acknowledge that I am hosting this webinar from Perth, Ontario, which is the traditional territory of the Anishinaabe, Huron-Wendat, and Haudenosaunee St. Lawrence Iroquois peoples. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. At Healthcare Excellence Canada, we continue on our learning journey and commitment to support improvement with and for all people in Canada. We are pleased to share that this program is delivered in partnership with the Canadian Centre on Substance Use and Addiction and the BC Patient Safety and Quality Council. I want to introduce our speaker for today's event, Dr. Bernie Pauly, who is a professor in nursing at the University of Victoria and a scientist at the Canadian Institute for Substance Use Research. Her research focuses on the implementation of harm reduction interventions in a variety of settings with attention to the organizational factors necessary for effective implementation. She is a University of Victoria Community Engaged Scholar and has been recognized with numerous awards for her work, including the prestigious Ron Draper Award for Health Promotion, a University of Victoria Community Leader Award, a BC Community Leadership Award, and Honorary Citizen of Victoria. Currently, she is the Island Health Scholar in Residence, a lead of the Canadian Managed Alcohol Program Study, and BC Community Laboratory on Substance Use. Her work has impacted regional, provincial, and national harm reduction policy and practices. I will now turn it over to Dr. Pauly to begin her presentation on the infrastructure for harm reduction, responding to multiple public health. Dr. Pauly, over to you.
Thanks, Jessica. And I just want to acknowledge that I'm a visitor on the traditional territories of the Lekwungen people, and I'm located in Victoria, British Columbia, and that's the territory on which the University of Victoria stands. I'm just going to spend a few minutes talking about what do we actually need in order to implement harm reduction. And I'm going to specifically focus on what we need in a time of multiple public health emergencies. And if you could go to the next slide. Often in the homeless sector and also in substance use services, we're dealing with many emergencies at one time. We've had a public health emergency declared due to COVID, but in British Columbia, we also have a declared public health emergency and escalating rates of overdose deaths across the country. We're also dealing with a public health crisis of homelessness that's impacting many people and has long been impacting Indigenous people, women, youth. And so what the situation we often find ourselves in as service providers and researchers is we're actually working in a context of many emergencies at one time. Next slide. So when we think about harm reduction, a lot of times this gets understood as we're going to, provide some clean supplies or we're going to set up a supervised consumption site. It's much more than that. Harm reduction refers to philosophy, culture, policy, programs, and practice. And it's often implemented and needs to be implemented in a context in which we recognize that we have these multiple emergencies that are driven by structural inequities, such as colonization, for example. Let's go to the next slide. So with the funding of Health Canada, we've developed a number of frameworks that really focus on helping organizations to better implement harm reduction in a culturally safe and appropriate manner with a focus on preventing harms of use. The first one is the 7-step harm reduction organizational framework. And in this, the first step really looks at the readiness of an organization. Do people understand the history of substance use? Do they recognize how prohibition policy has really led to and created harms like stigma related to drug use? Because we can't simply start to implement things. We can implement them and we should implement them, but the programs, but we need to do it in a context in which people understand some of the history of drug use and understand the history of colonization in relation to drug use. And so this framework says to start there. The other aspect of this framework that's really important is also around ensuring that there are appropriate policies in place. We often end up in a situation where we have substance use policies that prohibit use at the same time that we don't have clear harm reduction policies. So next slide. A key aspect of implementing harm reduction that's part of the framework and really should be at the center is how do we engage people with lived and living experience in terms of their expertise, their wisdom, their knowledge in terms of how to implement safely and effectively. And I've just put on this slide a few examples of resources that organizations could access if they're employing peer workers. On the right-hand side is a best practice manual from the Peer-to-Peer Project. And on the left-hand side are a number of documents created by BCCDC from the Peer Engagement and Evaluation Project. And so there's resources there about paying peers and how to work effectively with peers in the organization. But remembering that it's not simply hiring peer workers, but it's creating a culture in which there's a good understanding of substance use and substance use harms. Next slide. I think this slide really captures very well, um, the challenge that we have sometimes in organizations. Yoda said you must unlearn what you've learned. We've learned 100 years of prohibition policy, particularly around illicit drug use, and that has been a norm in our culture. And so when we're implementing harm reduction, we really do have to address that cultural aspect. Next slide. And this is an example of what I was talking about earlier, where, an organization might say, yes, we support harm reduction, but then there's no harm reduction policy. And we see things like zero tolerance for substance use, people told they can't use drugs and alcohol on site, or that it's prohibited to do that. Next slide. Um, so this resource, again, developed with our partners in the community, Solid Outreach, AIDS Vancouver Island, and Peers Resource Society. And it was really developed at the beginning of COVID to try and provide some guidance how you would actually implement harm reduction programs. So previous to this, I showed you the 7-point plan, which really talks about shifting the culture, the need for important policies, the importance of peers. And one of those 7 steps is to implement what you need. Here are basically the 10 points of what can be implemented in, this was developed largely for residential settings like a hotel setting, but could also be used in shelters or other places. And, it goes through the provision of safe supplies, having either peer witnessing or overdose prevention services on site, having access to primary care for people to access safer supply. And it goes through the specific infrastructure that's needed to implement within a broader culture. Next slide. The resources that I mentioned, they're all available on our website, which you see here, www.colabbc.ca. And those, all of the resources are either there or on the Toward the Heart website that I mentioned earlier. So I'm just going to stop there, and we have, I think, a good amount of time for questions. I'm excited to hear what people are interested in knowing more about.
Thank you, Dr. Polly. If you have any comments or questions, please feel free to share them in the chat box. For those who would feel more comfortable reaching out to a member of our team regarding your comment or question, please feel free to reach out directly to myself, Jessica Hodge, in either official language, and I'll make sure that your question gets to Dr. Polly today. I did have one question come through. You mentioned the importance of understanding the history of substance use. Do you have suggestions about how organizations can ensure staff obtain this knowledge and background?
Yeah, there's been some good resources that have been developed on understanding the history of prohibition in Canada. And I think you could look to the Homeless Hub has created some resources just recently that are part of their harm reduction course. And that one's really geared to people who are in the working in the homeless sector. But I think, that history of drug policy, there's been a couple good articles even in The Conversation, which is they publish very short pieces about that. And, I'm not sure, with, emergency shelters and supportive housing are very, very busy places, and I just appreciate how much um, you're doing and how much stress you're under. So you know having time to read is not always possible, but you can invite someone in to come and talk about prohibition and what's been some of the history and how has it affected people. And you can think of it as training very similar to like cultural safety training. And I know many of the harm reduction organizations, local harm reduction organizations in your community are really very knowledgeable about that history and the impact that it's had. So those are kind of some ideas around education and training or discussion groups. And I realize it has to fit into very full and busy workloads, especially right now.
Great, thank you for that response. We do have another question from Ron Lira. Thank you for your question. Do you have any guidance around implementing harm reduction within an in-residence treatment center or in treatment in general?
Yeah, this is a really good question. And, when um, we're thinking about residential treatment, um, there's certainly some principles of harm reduction that apply in terms of, not judging people around relapses, for example. People may come back multiple times. I also think of things like discharge. What kind of education and information can be given to people at discharge? Because we don't have control of what's going to happen after someone leaves. And, they may be in a situation where something happens with, a script, a methadone script or something, or if there's, you know, substitution therapy, they're not able to get it because the drugstore is closed. And we don't know how that's going to impact people. So, really preparing them with information around that and, conversations around what's going to be realistic for people in terms of their use, recognizing that the bar of abstinence, that's a high bar that we set. And, people can make that choice at any point in time, but we want to make sure they're alive to make that choice. And so your question's a really good one about implementing harm reduction in settings that may have specific goals of abstinence.
Great, thank you so much. Another question we received was number 10 on your last slide speaks to harm reduction and OD training for staff and residents. Can you talk about settings where you have seen this done well and what factors may enable this?
Yeah, so I think one of the things that really enables this is when you have people with lived experience who are involved in the training and who are able to share that training with others. So in this case, I'm talking not just about staff training, but also training for people that are in the setting, that are living in the setting, participating as clients. So peer-to-peer training, I think is really important. And I would stress that also with staff training, having peers involved is really important. And sometimes you can see a really nice pairing of people from healthcare, nurses, my background's in nursing, working with people with lived and living experience to be able to um, provide different aspects of the education together.
Great, thank you. As you said, engaging those with lived experience and living experience is such an important aspect in the design, delivery, and evaluation of services. Is it possible to find more information on this in the resources you've mentioned?
Yeah, in the resources, the two places that I would point you to are in the BC CDC. There's the peer engagement section, which has a lot of the resources around guidelines for paying peers, really guidelines for facilitating involvement of peers. And it's not just employing them, but it's also engaging them in the design and the development and the as well as the delivery of services. And I think that's a really important kind of aspect and engaging them in the policies. And so the one resource, as I mentioned, is the peer PEEP, the peer engagement and evaluation project through BC CDC. But another resource on Toward the Heart is it's got a whole section on Towards the Heart about peer resources. And one of them is the uh, peer-to-peer project, which is a project that was led by Jane Buxton and I in and co-led by Solid Outreach in Victoria and Rain City, Vancouver. And there's just an incredible wealth of resources there. There are training videos. There's a wonderful video on there called A Day in a Life of a Peer that was professionally produced, and it follows a number of people who are peer workers in Vancouver and Victoria, and they just talk about their work and what they do. And that day in a life was developed because what people who with lived experience told us is that a lot of people didn't know what they did or didn't understand their role. And so the day in the life is, it's a really, I think, great video. It's easy to watch. It's not very long and just exemplifies what peers do. And then as part of that project, we also worked with Solid and Rain City to basically identify a number of strategies that organizations could use in order to support uh, people who are with lived experience who you're working with. And the motivation for that really came from peers themselves who said, like in the overdose emergency, it's often people with lived experience who are the first, or living experience, who are the first line responders. And they're basically have all this expert wisdom and knowledge, but they don't have access to the same resources and supports, that other frontline providers might have, like employee assistance programs. And so that would be an example of a lot of resources in one place under the Toward the Heart website. And like I said, you just go to the peer resources and you can just see kind of a wealth of information there because as I mentioned at the beginning, we're dealing with multiple emergencies right now, including the overdose response. And so really looking at how we can support people with lived and living experience who are just so expert in doing that work, I think is really important aspect of implementing harm reduction.
Great, thank you. And we do have a SharePoint site where we share resources with the group. So we will make sure that we link to those resources that you've mentioned so people can access them after the huddle as well. One more question that we had come through from Grace Kramer. Thank you for your question, Grace. Do you have a specific discharge plan and resources for the individual to turn to?
I don't know if Grace can clarify, but discharge plan, would that be from like a treatment center or from some other setting? Um, and the reason I ask is that discharge planning tends to not be that well done. So I really, really appreciate the question, because we often are sending people off, and they're being discharged and not necessarily being discharged into an environment that's going to support their continued, okay, great, from discharge center or facility. Sorry, treatment facility.
Yeah,
Um,
so I think Grace is mentioning a substance use center or facility and discharge from that location.
right. So I don't have a specific copy of a plan, but if I was thinking about what some of the things are that should be in that plan, I would think about what some of the determinants are of harms of substance use. And so I would be thinking about, is the person, is there housing part of that discharge plan? Because housing is a determinant of harms, is there's some attention to employment or income? Are they connected to community supports? And do they have, harm reduction information in case they need it? So those, you know, are the things that immediately come to me that should be in a discharge plan. And so if you're asking centers to see their discharge, if they have a template, I would look at it really carefully and say, are some of these key elements in it?
Great, thank you for that. And I think you've touched a bit on this next question, but when we think about harm reduction, we often automatically think about the current opioid epidemic and drug consumption practices. Can you share your view of harm reduction and does it extend beyond consumption practices?
Oh, thank you so much for that question. The field of harm reduction has long been dominated by reducing the harms of illicit drug use. And, you know, um, in the 80s, that was really focused on, needle exchange as a form or needle distribution as a form of harm reduction. And then as overdoses became more of a concern, um, they were a concern all along, but we had the implementation of consumption sites, both the supervised, the formal supervised consumption sites, as well as, overdose prevention sites. And those kind of interventions dominated the landscape. One of the areas that I work in really is around alcohol harm reduction. And I lead the Canadian Managed Alcohol Program study, and we're looking at how can the supervision of safe and regulated sources of alcohol for people with very severe alcohol use disorders prevent harms. And we've got a whole set of research that we've published around that. Um, but I think your question also leads to, what are some of the broader determinants of harm? And I already mentioned housing. Homelessness escalates harms of substance use. We also know that for poverty. So when we're thinking about harm reduction, also thinking about housing. Colonization has driven um, harms of substance use for Indigenous people, and is very much implicated in high rates of overdose death, impacting Indigenous communities. And also, we need to recognize that decolonization of harm reduction itself is really important, because I've been talking from, I'm a settler, I've been speaking from a Western view, but there's the whole importance of what does what does harm reduction mean in an Indigenous context? And First Nations Health Authority here in British Columbia has done work about decolonizing harm reduction, and how there's some wonderful resources that they've developed for training that talks about it in an Indigenous context. So, and we can even go farther than that when we're talking about harm reduction. We can talk about, sex work would be another example. And I think probably where I should have started is, harm reduction is in everyday life. We don't say, please abstain from driving cars. We say, please wear seatbelts because we know that's safer. I love to ride a bicycle, but I wear a helmet when I ride a bicycle. So, a harm reduction really means preventing harms associated with use or a particular kind of behavior, and as kind of a approach, because abstaining, in the case of abstinence, in the context of substances, like I said earlier, we're often setting the bar very high, and that's a choice people can make, but it's a choice that we want to support them to make at the right time, not force them to make. So harm reduction is really important as part of the continuum of policies and services. And I apologize, that was a very long answer.
Well,
But
that
it was
was a
such a
great
great
answer.
question. It was
Thank
a
you.
good question.
I think we've got time for one more question, and we'll wrap up with this one here. Thanks so much for your presentation and sharing these resources. Given the pressures on time and resources is there one thing you think is most important for us to take away and turn our minds to when we return to our organizations after this huddle?
That is a super question. I think the one thing to take away um, is to ask the question, what's the culture in my organization around substance use? And if there's sort of an understanding of the history of prohibition, if you already embrace harm reduction policies and principles, then go to the next question and say, well, where are people with lived and living experience? How are they engaged in the design and delivery of our services? And if you're already there on that, then say, well, how well are we supporting them? So I didn't give you one thing. I gave you three things to consider, three questions, depending on where your organization is at. And so maybe the really big one thing is having a look at your organization and asking yourselves, where are we in terms of implementation? And you could even take that 7-point implementation framework, which has a bunch of questions in it, by the way. We laid it out in that format, and use it to do a bit of an organizational assessment to determine, what am I going to do next? How are we going to push ourselves to a better, more effective level of implementation? Because we all have a lot of growing, I think, to do in this area. So much all the time we're learning. So thanks for coming to the huddle, and thanks for giving me the opportunity to be here with you.
Well, thank you so much, Bernie, for your presentation. Our next learning event will be on November 16th from 12 p.m. to 1 p.m. Eastern Time. This webinar will focus on reflections and lessons learned during the COVID-19 pandemic from the perspectives of teams participating in the Learning Together program. This will be followed by a webinar on December 2nd from 12 p.m. to 1 p.m. Eastern Time with the Canadian Alliance to End Homelessness and Jean-Louis Denis, an overview of the initial, current, and anticipated challenges of the COVID-19 pandemic and pandemic recovery will be highlighted, followed by discussions around change management and adaptation. A special thank you to Dr. Bernie Pauly for today's presentation. Please be sure to take a few moments to complete the feedback polls on your screen. I know more about building infrastructure for harm reduction than I did prior to attending the huddle, from strongly agree to strongly disagree. Overall, I was very satisfied with my webinar experience, again, from strongly agree to strongly disagree. and I will be able to apply what I learned from this webinar in my work, from strongly agree to strongly disagree. Please click submit to share your poll answers with us. And thanks again, everyone. Goodbye for now. We'll see you next time.